So I think listening is about being in the moment with either individuals or with groups of people. And that's a really important thing. It's about being present. It's also about not being defensive. And it's about not overlaying our own thoughts, views, beliefs that will confuse the messages that we're hearing from other people. We need to listen because we need to know what it is like to be led by us. And we won't know if we don't listen what people are telling us. Secondly, how can we improve if we don't listen? And we're all about improvement. We talk a lot about improvement. The only way we can do that is by listening. And thirdly, how do we create a culture in the organisation where people can be themselves, where people aren't afraid to say what they're thinking about? They're not afraid to share with us issues that impact on quality and outcomes, either for working with us or for receiving care with us. That's all about listening. How can we create that culture if we don't listen? Thank you.
As a board member, I support the Freedom to Speak Up Guardian, but I'm not always aware of the issues that impact on people on a day-to-day basis. So for me, it's really important that I do walkabouts and that I speak to individuals personally. So in terms of this question about the power of listening, it's about listening to what people have to say. It's about giving them that opportunity to speak up. So at CityCare, we would like to think that if there was anything that was of concern, if there was any malpractice that was occurring, if there was behaviours that didn't accord with our values, that we have staff that really would feel psychologically safe and confident to speak to us about it. In particular in CityCare, where we have quite a diverse workforce, if we don't listen, we can miss cultural cues. We can miss body language that's telling us that what someone's articulating is very different from what they're actually trying to say to us. So being able to listen is it's just an important skill.
So one of my greatest learnings since I've worked at NUH is the power of listening. For me, particularly working in an organisation where we're trying to change the culture, listening to people helps me build trust and confidence in relationships, particularly when you're new to an organisation, as I was when I joined. It helps gain understanding of complex issues. I learn a lot more when I'm listening than when I speak. It definitely helps with encouraging openness if we actively listen to people and their concerns, and it helps us solve problems. It's also really good for personal growth. If you can learn effective listening skills, it really helps you develop your approach to work and your career. And lastly, I think it's really good at helping resolve conflict and deal with difficult issues, because if you seek to understand the issue, you've got a much better chance of creating common ground and then resolution. So for me, listening is a really powerful tool, and I try and use it as much as I can.
Hi, I'm Jen Gwyver and I'm the Exec Director of People and Culture, and I'd just like to take the opportunity to say a few words about our Freedom to Speak Up for October month. It's so important that people across the organisation feel able to speak up when things aren't quite as they feel they should be, or if they're struggling at work. But the most important thing, which is the theme this year for Speak Up for October month, is to listen, to really, really listen. I think I've made my own reflections over the past few weeks that sometimes you can listen, but you're listening not with the purpose of really listening to understand. And as an executive team, we're really keen to not only hear what you're saying, but also listen, understand, and then crucially follow up on what's been said so we can make your time here at Notts Healthcare as good as it can be. Thank you.
Hello, my name's Clive Clark. I'm the Director of Inclusion here at NUH. I know that the NHS is passionate to everybody who works in it, treated by it, and the communities it serves. But the NUH can only continue to provide high quality care if it continues to be a learning organisation. And by that, I mean a listening organisation, listening and acting. So this month of October, a Freedom to Speak Up month, I encourage all, when you see something, good, bad or indifferent, to not only walk past it, but to be able to talk about it to somebody who will listen and also act. Because that is how we are going to get the NHS that we all want and deserve. Thank you.